Hello everyone, my name is Emily Young and today we're going to talk about the case of Skylar Dirt. Phase 1, the introduction. The nurse came in the room and so the 6 things that were wrong were no hand washing, no introduction, the nurse did not ID the patient, the nurse did not obtain a pain score, she did not ask about allergies and did not ask how much the patient had to drink after he told the nurse that he had been into a little bit of Jack Daniels. And she was not wearing a mask. Under normal circumstances, you wouldn't have to wear a mask in this situation, but since we're in a global pandemic, a mask is required. Phase 2, the assessment. The nurse does not use inspection. She palpated before she auscultated the abdomen. The bed rail was left down. There were no probes for the thermometer, so the nurse used her hand and was like, you're good. The nurse could not get a good blood pressure reading, and she didn't attempt to get a new one. The nurse asks if his back is tender, and the patient says yes, it is, and the nurse continues to hit his back kind of hard. If a patient told me that his back was tender, I probably wouldn't do any more than just a light palpation. In this part, the nurse was wearing a mask, but it wasn't covering the nurse's nose. And for the mask to do its job, it has to be covering the nose and the mouth. And the last thing wrong in this little skit was the nurse leaves the room while the bed is still raised and the bed rail is lowered and the call bell is not in reach. Phase 3, diagnostics. What diagnostics are the priority? The blood pressure is elevated at 160/82. The heart rate is slightly elevated at 101 beats per minute. Respirations are elevated at 24 breaths per minute. The temperature is unknown. Red blood cells are 12 and should not be over 6.1. White blood cells are 15 and should not be over 11. Bilirubin is 1.3 and should not be over 1.2. The underlying medical problems going on based on the physical assessment and diagnostic findings are pyelonephritis and kidney stones. Additional diagnostic testing that could be ordered are an ultrasound and urinalysis. Phase 4, treatment. The nurse says the patient doesn't need his call bell and that she'll be right there for him if he needs anything. It doesn't matter if she'll be there or not. The call bell should always be in reach. The nurse is threatening that if the patient doesn't stay in bed, she won't give him his medicine. The nurse does not ask his pain level. Instead, she assumes it's a 10 on a scale of 1 to 10. The nurse says she's going to make the blood pressure cuff as tight as she can. You shouldn't do this. If the blood pressure cuff is too tight, it could give you a false high reading. And if the blood pressure cuff is too loose, it could give you a false low reading. On the cuffs, there's like a margin where it should fit, and if it's too big or too little, then you should find a new cuff. The patient asks what his blood pressure is, and the nurse just says it's all right when it's actually elevated. The nurse takes an axillary temp when it's supposed to be oral. The temperature didn't read, but she makes one up at 100.5. She's using her personal cell phone at the bedside. The nurse left her mask at the nurse's station because she was eating a snack while working at the computer. She did not perform the rites of medication. The 8 rites of medication are right patient, medication, dose, route, time, documentation, reason, and response. And the nurse also did not witness the patient take the medication before leaving the room. Phase 5, complications. The nurse had not checked on the patient for 3 hours after administering the medication. The patient states loudly in the hall, the nurse states loudly in the hall, "Yeah, I know, it's a pain." Takes too long to lower the bed and get help. Takes too long to lower the bed to get help or start compressions, which he wasn't a full code, so she shouldn't have done that anyways, but if compressions were indicated, then she should have yelled for help and started compressions immediately. The nurse was unaware of her patient's code status and begins compressions even though he's a DNR. While looking at the chart for the DNR, the nurse finds that he has a codeine allergy. And the nurse left the wife and the patient in the room while the patient was actively dying.